Hello everyone, welcome to Spine Focus. In our last video, we discussed how osteoporosis weakens our spine and this can result in fractures even with trivial injuries. Today, let us discuss about the management options available for osteoporosis, how we treat an osteoporotic compression fracture. Also, we shall discuss about the methods or the steps that we need to take to prevent such fractures from happening in the future. Most of these osteoporotic spine fractures can be managed conservatively. In the beginning, a few days of bed rest along with analgesics or pain medications to keep the patient comfortable are advised. However, prolonged bed rest is not recommended for elderly patients as this can cause more complications. Prolonged bed rest can cause blood clots in the legs, it can affect the chest function, it can cause infections in the lung, pneumonia. It can also affect the muscle health. It can cause wasting of the muscles and weakening of your bones. Hence, we need to get these patients up and about as quickly as possible. After the initial few days, as the pain gets better, we encourage these patients to get up, sit and start walking, taking a few steps. And most of the times, we prescribe a spinal support or a brace which could provide some pain relief and it could support the spine during the initial few days of mobilization. The good news is that most of these fractures would heal in about 10 to 12 weeks. Serial x-rays are to be done as specified by your spinal specialist or your spinal surgeon. These x-rays would make sure that your fracture is healing well and that there is no significant collapse that is happening at the fractured level. It is mandatory to avoid bending forwards or lifting weights during the first few weeks after you've sustained the fracture. Once the initial pain subsides in about 4 to 6 weeks, gentle exercises are recommended. These exercises would help to strengthen the back muscles and also to improve the flexibility of your spine. Weight-bearing exercises for your back are recommended to improve bone and muscle health. About 150 minutes per week of weight-bearing exercises like walking, climbing up the stairs are recommended. Along with this, muscle strengthening exercises or resistance training is also mandatory, and this has to be done at the frequency of about 2 to 3 sessions per week. Use of resistance bands and light weights are recommended. Food is one of the most powerful medicines for bone health. The three key ingredients include calcium, vitamin D, and protein. On an average, adults need about 1200 milligrams of calcium and 1000 international units of vitamin D per day. Good sources of calcium and vitamin D includes milk, curd, cheese, nuts, and fish. In elderly population, they may not meet these requirements through their diet. Hence, it becomes mandatory to supplement calcium and vitamin D. Along with calcium and vitamin D, proteins form an essential element in maintenance of bone health, preventing osteoporosis and strengthening your muscles. So the recommended daily requirement of protein is about 1 gram per kilogram of your body weight. So if you are a 60 kilogram man, you would require about 60 grams of protein per day. Rich sources of protein includes egg, meat products, chicken, and for vegetarians, pulses, lentils, soybeans, paneer. Along with a healthy diet, it is essential to avoid smoking and to reduce the consumption of alcohol as this can worsen osteoporosis. Nutrition and exercises are the foundation, but many patients also require medications for osteoporosis, especially if you have confirmed your osteoporosis using the DEXA scan, bone density, and if your T-score is below 2.5, then your doctor may put you on specific medications to improve your bone health. These medications are designed to prevent bone loss and also to increase bone formation. There are different medications which are available. So the type of medications that you need to take will depend upon your age, your risk for a fracture, and also the medical conditions that you suffer from. Remember, this treatment has to be done under strict medical supervision as the treatment could be prolonged and you may have to take these medications for many years. Most of the osteoporotic fractures happen after a fall. So along with treating osteoporosis, it is equally important to prevent falls. At homes, especially for elderly population, it is essential to modify the surroundings, to increase the lighting within the house, especially in the toilets and the stairways, to install grasp bars and non-slip mats. Along with these, the reason for the fall needs to be investigated. For example, it could be a cardiac problem, something related to the heart's rhythm, or maybe related to your hypertension, could be problems related to your ear balance, or the most importantly, the eyesight or the vision of the patient could be at fault. Remember, most of the cases of osteoporotic spine fractures can be managed conservatively. However, in a few group of patients, the pain may persist and this could affect their mobility and they could be bedbound. In these patients, there is a simple and an effective surgical treatment option called vertebroplasty, about which we shall discuss in the next video. Stay tuned.